Do I have your permission to record the simulated evaluation of the elbow and forearm for my exam and diagnose 2 course?
Yes.
Alright. So we're doing carpal tunnel syndrome. Some of the history that you would want to ask them is, how long has it been hurting? Or first you want to go with, where does it hurt? Try to get them to pinpoint where. So for ideal, be like, where does it hurt? Point right towards the wrist. Ask them, how long has it been hurting?
Month.
Did you do anything that caused the pain?
Mm-hmm.
What does your posture look like at work, or while just general?
Just sitting like this.
Yeah. Most of this you'd want to do sitting too. What do you do for work?
I'm a teacher.
What do you do outside of work? What's some of the extracurriculars you like to do?
Play video games.
Are you console or PC?
Console.
How often do you use a computer?
Every day.
For how long do you normally use one? Or are you normally on your computer?
Probably about 6 hours or so.
Another good general question would be, how old are you?
23.
So some observations, you would have them, you can do it standing, but ideally you'd want to see how they sit. Good signs of something could be wrong is rolled shoulders, probably bad neck or neck positioning. If you shake their hand, especially the one that's affected them, they might say that it relieves a bit of their symptoms. You can also look around the palmar aspect to see if there's any thickening. Also atrophic of the thenar eminence if the symptoms are more chronic. So while you're palpating, obviously you want to start distal forearm, kind of work your way down just to make sure there's no nerve or sensation issues, as well as blood supply issues. Next, you'd want to go towards the fingers. They might have some numbness, tingling around there as you're moving and feeling it. And then work your way towards the palm or towards the wrist, where there will be tenderness as you touch it. Special tests. So for a manual muscle test, you'd have them go through their active range. So just flexion, eversion, radial ulnar deviation, radial deviation, supination, pronation. It could be limited due to stiffness. Also, it's not that great to notice that because it could also not be limited at all. When you're manual muscle testing, in chronic cases, the strength of the abductor polliculus brevis, flexor polliculus brevis, and opeminens polliculus may be decreased. Your passive range of motion, the medium nerve symptoms may increase as wrist gets fully extended and flexed. So they might feel it more that way, or flexed or extended. Also could get goniometry readings because if they do have slight stiffness, as well as just a general grip strength test, see if it affects their grip strength at all. Joint testing, you don't really have any stress tests for it, but joint play, you can joint play around the metacarpals. You'll usually see you can see hyper or hypo mobility of them, of the intercarpals or radial carpals. Some of the selective tests, you have the Tinel's test, so you want to try to find the ulnar nerves, keep it at 90. Try to find the ulnar nerve and just tap there, see if they can feel that, if they have numbness or tingling right in that pinky. As well as the failing sign. So what you're going to do is you're going to sit like that, keep your hands, point your fingers down, and just push in as much as possible. A positive sign of that would be painness or numbing at the wrist and hands. You do want to do a neurological screening, so just try to just feel around, see if they have sensation still. As well, there'll be decrease in their median nerve, so about their second and third phalange, they'll have less sensation around there. As well as a cap refill, just to see if there's no vascular issues. Some social determinants of health that you got would be everything that you get in your history and observation. And some other things you could see or need is if they're a drinker or smoker, what kind of transportation they have, are they able to take time off of work, do they spend prolonged periods of time at a computer, also to see if they ride a motorcycle, or do they have any autoimmune diseases or degenerative problems. Acute care, you could give them some stretches to help try to relieve or stress on if it is a issue on there of a compressed nerve, as well as maybe strengthening up the muscles around there just to help. You can refer/get imaging. Radiograph will help rule out if there's any bony impingement around the median nerve, and an MRI can be used to help assist in identifying any soft tissue compressions of the tunnel, but probably not needed unless they just absolutely want to know for 100%. Differential diagnosis that could go along with this could be thoracic outlet syndrome, nerve root compression, proximal median nerve compression, pronator syndrome, and anterior interosus nerve syndrome. So your ICF model, the health condition would be carpal tunnel syndrome. The body functions that would be affected and structures would be your hand and wrist. Those will be affected, and you're not going to be too limited towards the daily activities unless they want to play video games on a computer or if they ride motorcycles. Really just want to make sure whatever they do doesn't cause pain in that or cause flared up of symptoms in the affected hand. Limitations, again, not really going to be too limited. However, if they do utilize a computer for most of their work, you might want to see if you can find a way to get around that for the time being. And if at all, you could put them in a brace to help kind of limit that flexion and extension of the wrist. Participations, again, no limitations as long as they don't have pain. Also, it could be, if needed, if they're a motor or a dirt bike racer, you might want to hold them out for a few weeks until you can calm the symptoms down. Some environmental factors is what do they do at work, what do they do as a sport, what kind of form of transportations do they have, can they afford to take the time off, can they modify what they do at work if they're not able to take off, and do they have a good support group in their family and friends. Some personal factors, do they ride a motorcycle for fun? Do they use a computer for fun? Are they motivated to get rid of their symptoms or to at least lessen them? And are they a motivated worker or need to be on their computer at all? And that's it.